Hi guys, welcome to week number 8. This week again we have 2 chapters to discuss, but they are the same 2 chapters from last week, just some different pages. So again, we're going to be working with chapter 33, pages 722 to 724, chapter 38, pages 873 to 875. 4 pages. That's all you guys have this week to read. So I really hope that you will make some time to read those 4 chapters. So for chapter 33, we're looking at the male reproductive system now and urology. And then in chapter 38, we're assisting with the urinary system and male exams. So let's get started. So chapter 33, again, we're dealing with the male reproductive system. And the male reproductive system is really the main function is to provide the sperm cells to fertilize the ovum or the egg in the female. Male reproductive systems do consist of external organs and internal organs. The external organs are the scrotum and the penis. Now the scrotum is a pouch-like structure that is actually behind the penis, and it's divided into 2 sacs. Each sac will contain one of the 2 testes. The penis is actually composed of erectile tissue covered in skin. Size and shape of the penis will vary depending on the patient, but when erect, most penises are about 6 to 8 inches in length. The internal organs of the male reproductive system are the testes, the epididymis, the ductus deferens or the vas deferens, and the urethra. So let's take a look at each of those. The testes, like we talked about, are housed in the scrotum. Those are 2 oval-shaped organs. And what they're responsible for is actually creating that male hormone testosterone, as well as the sperm. The epididymis is a coiled tube that actually lies on the upper rear position of the testes. Now, here's the very interesting thing about those. They are about 13 to 20 feet long, but they're actually coiled into a 2-inch space. So they're very tiny, but there's a lot of tubes that are within that. The vas deferens or the ductus deferens is a slim, slender muscular tube that's about 18 inches long, and it extends upward towards the epididymis. This is the duct that actually will excrete the sperm for men and testosterone. And lastly, the urethra. Now this is approximately 8 inches long and is divided into 3 sections: the prostatic section, the membranous section, and the penile section. The urethra actually extends from the bladder to the end of the penis, and it really functions as the orifice that expels urine and semen from the patient's body. Alright, so we're going to switch gears now. We're going to talk about chapter 38, and remember, it's just pages 873 to 875. So chapter 38 is talking about the male reproductive system combined with the urinary functions. So when you're dealing with these 2 systems, there are 3 main procedures as a medical assistant you might be assisting the provider with or helping within. Those are a circumcision, a testicular exam, and a vasectomy. So let's talk about those. When we talk about circumcision, this is the removal of the foreskin from the penis. Generally, it's pretty customary that this will happen to newborn males, generally shortly after they're born, and it gets done in the hospital. It's really believed that in doing a circumcision, it actually promotes cleanliness for the patient, and it helps to reduce the possibilities of contracting genital warts or any other types of infections. Testicular exams really won't be something that you might help with, but it might be your responsibility to set up any equipment that the provider might need during that exam. And a vasectomy is a surgery that's performed to render a male sterile. What happens is you actually cut the vas deferens and you tie off the ends of that to prevent any sperm from being transported out of the testes. This is really a very brief procedure, and it can be performed right in the office setting. Patients don't have to go to the hospital. The nice thing about this procedure is because it is so brief, patients actually get to go home immediately after, and they can return to work and other activities the next day. All right, so that's the overview I have of those 4 pages or 2 chapters for this week. Please, I really beg, it's 4 chapters. Please read your chapter. Please read those pages so you can actually be knowledgeable for your discussion post and your written assignment for this week. So this week's discussion post is surrounding circumcisions and the setup of the trays for circumcisions. You will need to explain in your own words, that's the key piece, in your own words, what you will need to do in advance to prepare for that procedure. You'll need to include what items are needed during that procedure, how you will prepare the patient and the parents for that procedure. Please make sure your initial discussion post is completed Tuesday by midnight, and your 2 responses are completed Saturday by midnight. Also this week you have 1 written assignment with 2 parts again. Both parts should be answered in the same Word document, so you only have 1 submission. The first part is about a case study. So what you will need to do is actually read that case study that's found in Angel under the written assignment and answer the questions that do accompany that case study. This should be done in a 1-page APA formatted paper within Word. And then for the second part, what you'll need to do is create a patient handout on 2 of the urinary disorders that are listed again within that written assignment on Angel. This handout or the brochure, whatever you choose to make, should be able to help you educate your patient and provide information about the 2 diseases that you do choose. Please remember that your written assignment is due Sunday by midnight. And if you have any questions or concerns, please send them my way. And if not, I look forward to seeing everyone Tuesday evening or afternoon. Have a wonderful day, guys. Bye-bye.